Hello everyone, my name is Dr. Atul Prasad. I'm a neurologist. I'm working at BL Kapoor Super Specialty Hospital, New Delhi. I'm the head of department at BL Kapoor. Just to share my thoughts about multiple sclerosis. Multiple sclerosis is a fairly common disease. It usually occurs in both males and females, but females or ladies are much more susceptible to developing the disease as compared to men. It's approximately twice as common in females as in men. It usually occurs in the age group of 20 to 40, which is a little bit unfortunate, because that's the time when we are just out of college. That's the time when we are about to look for work, and it can be devastating if it's not picked up early and treated early. So we should know something about the disease. Multiple sclerosis literally means there are two words in this: multiple and sclerosis. Sclerosis means white spots. It means areas of damage in the brain and spinal cord, which we see on a scan. That's what sclerosis stands for. Multiple means there are multiple shadows. It's quite simple. It's plain English. It's basically a disease of the brain and spinal cord, where the covering of the brain or spinal cord is known as myelin. It gets damaged. Now, this myelin is required for conduction of nerve impulses. So if it is damaged, the impulses cannot be transmitted, and the patient, he or she suffers from the disease. Why it occurs, why multiple sclerosis occurs, we do not know. Patients may have a genetic basis, and these genes are modified by the environment or some kind of a latent viral infection which triggers off or which sets in motion the disease. It usually presents with vision involvement. They may have double vision, or they may have reduced vision in one eye. They may have imbalance attacks, what we call ataxia. They may have tingling in the hands or legs. They may have paralysis. They may have weakness. They may have bladder or bowel involvement. So practically any part of the neural axis can be involved, right from the eyes to the spinal cord to the brain, and depending on which part is involved, patient will have different symptoms. If anybody has these symptoms, he or she should show a neurologist, and the neurologist would like to do some tests for the patient. He would like to clinically examine the patient. He may do imaging. He may do brain or spinal cord imaging, or both, and some specialized tests like lumbar puncture to look for special proteins in the cerebrospinal fluid. This disease can have many presentations. It can present for the first time and go away and then come back again, which is known as relapsing remitting multiple sclerosis. Or there may be one episode and it can tend to keep on progressing, in which case known as progressive multiple sclerosis. We all want the disease should not occur, of course, but if it does occur, it should be quickly diagnosed and quickly controlled. It can be treated, and patient can lead almost a normal life with medications. The medications which are available are both injections and tablets. They can be given in the form of injection, which can be thrice a week or once a week or once in 3 weeks. Different preparation, different injections. The doctor takes a call what particular injections, what particular medicines patient needs. It used to be a rare disease. It used to be a disease where the drugs were not very easily available, or they were very expensive. But as of now, the medicines are easily available, quite affordable. The monthly expenditure works out to a few thousand rupees, anywhere between 2,000 to 4,000 rupees. It's quite affordable, and the quality of life changes remarkably. If the attacks can be controlled, if the attacks are treated, patients lead almost a normal life. My advice to patients or people, caregivers, for managing the disease is of course to be quickly diagnosed and quickly treated. They should lead a very active and a healthy life. They should be as active as possible, both physically as well as emotionally. Do yoga, do physical activity. The more you do, the more you train your body to be more flexible, to be more active, to be able to fight the disease. have regular sleep and waking hours, have a regular lifestyle, eat on time, don't miss your meals, go for a proper either gym workout or just go for a walk on the roads, and try to build yourself up emotionally. Do yoga every day. Try to have some kind of mental strength to fight the disease. It's a disease of the young. These are the people who are more vulnerable. These are people who feel that they have a disease which is devastating. It's not like that. It can be controlled. It can be to some extent sent into remission or cured. But patient requires to be treated, to be diagnosed and treated as early as possible. Thank you.